When I cry, I'm like, oh, it's
I've been retired a long time now. You look good.
Thank you.
So things are going.
I can get up money. Oh, here I am. I actually got it right. It took me a while. I might have to, okay, to rely. Very good, very good.
I didn't know.
Good morning, everybody. I didn't even get to the mic. Can you hear me? Okay, so I'm gonna go ahead and I guess I have to use it. Yeah, yes, ma'am. Okay. I'm Melanie Kelly. I am the executive director of the Alcohol, Drug Addiction, and Mental Health Services System for Montgomery County. First off, thank you. Thank you for being here 9 o'clock in the morning, and thank you. So I am just going to kind of set so that you'll be quiet as Agnes for the rest of the morning. And we'll hear from you, because that is our goal. We want your voices heard. And I know we've got folks on the screen. As I'm looking around the room, we've got folks who attended one of the earlier community listening sessions. We appreciate folks turning out for these, because this is an important issue that we really need to hear your voice on. So we're talking about community services. We did have a provider that was started working 5 years ago to bring these services online for us. We have had services in our community now for the last 3 years, and we brought the continuum of care in 3 separate stages. The first one was our call centers, having a place to call in terms of the mental health crisis. Our call center was receiving on average 1,400 calls a month. So the need is really clear in the community to have some place to call. We have had a mobile crisis service also, so that they were able to get out to, and I think some police officers in the room and some on the virtual screen. And they know how important it is because they carry so much of that load. And they did it for so many years without any assistance whatsoever. Being able to get out to someone who is in a mental health crisis and getting them to a safe place, from the quick rescue, getting them to a safe place for service. The third piece was a place to take loved ones, to take someone who might be in the midst of a mental health crisis, so that they could indeed be in a place where they can be assessed and observed and connected back if they had a service provider, or connected to if they didn't have a service provider. So that was the continuum that we had in our community up until just over a month ago, because we unfortunately had that provider pull out of Montgomery County. We brought a recommendation for replacement services to our board of trustees, and they did not approve the recommendation because they really wanted to do a couple of things. One of them being to look at local services, and the other one being to hear from the community in terms of needs as we start talking about the replacement of those crisis services within the Montgomery County region. So that's where we are today. We want to hear from you all in terms of any kinds of needs that you're able to address around crisis services. And it's not just mental health, it's a whole behavioral health system. It's mental health as well as substance use. What are those things that you feel that you need if you have a need for a service or you have a loved one who has a need? What do you need in that moment to be able to get back to a level of stability? So I'm not going to be the ones who's going to be doing all the talking here. We're very fortunate because we do have a facilitator for this meeting. So we're going to all just be listening mode. As you all talk about that, I want to introduce Scott McGowan. I probably did not need to introduce, so I am presenting Scott McGowan because so many of you know him in this community. And he is going to take the lead of facilitation. And we're very lucky to have had him say, yes, I'll do this. Because he brings so much to this experience. Scott, thank you. And again, thank all of you.
Thank you. Thank you very much. I recognize some of you from the other events. My name is Scott McGowan. Born and raised in Dayton. Went to kindergarten in Miamisburg, grade school in West Carrollton, and high school in Centerville. This community has given me a lot, and I feel like in the end of maybe my time here on earth, my last third, I owe this community more. I'm married to a woman named Lori. Been married for 37 years. She's my best friend. I have 2 grandchildren. Those of us that maybe have grandchildren, we should have had them first on this planet for sure. I have another son who is also married, expecting a child. I'm ready to go on Breaker as a CEO for about 12 years, and I just retired in March. And so when Tina reached out to me and said, hey, would you help us maybe consider facilitating this conversation? I said I would. Maybe first of all, under one condition, is I didn't want to know a lot of details in regards to what happened, why it happened, who was involved in that. Personally, I don't have a horse in this race. What I deeply care about is I care about the lonely, tired, broken, and brave. I was 43 years old, 16 years ago. From the outside, it looked like I had a lot going on. My career, maybe where I lived, what I drove, and what I worked. But honestly, deep down, I didn't want to live. I just wanted to die. And fortunately, I was encouraged by great people in this community. They entered the recovery rooms of Montgomery County. And I entered the rooms and I said, my name's Scott, my soul is broken and it's cooked, and I'm lost. Recovery changed my life. Gave me redemption, purpose, gave me meaning. And it allows me today to be useful in that. So what I care about in this community in regards to what we're talking about, crisis cares. What is the best thing that we can do to help someone be tired, broken, and afraid? When we think about having this conversation around this, a couple of things that we're going to break it, we used to have this strategy called WAIT, and it really stands for why am I talking? So as we're like presenting or sharing ideas, a couple of things to think about is what I'm about to say, is it useful, is it helpful? What I'm about to say, is it kind? What I'm about to say, am I repeating maybe what somebody else has already said? And then one of the things that we wanted to do was at the very beginning, there was numbers up there. If you had comments you'd like to share, we had note cards. So what I'm going to ask Tina to do, if you had a comment or you'd like to comment, if you could raise your hand, I'd like to have Tina pass out these note cards. It would be great. Be brave. And we got one. Otherwise, I'm going to draw it out again. Okay, is that it? Any more? Okay, so let's just imagine that there's more than one. Fair. What we're going to also ask you to do is, because we're on Zoom, is maybe if we could, and it looks like, that camera is gonna be able to span about, probably between these two screens. So what I'd like you to do is stand up, and stand up here and share your comment, your feedback there. Okay. Now, also, when we talk about, what we're gonna share and how we're gonna share, I don't necessarily have a large desire to, talk about why, right? Why this happened or who. I have a strong desire to be able to define what needs to happen in this community and how we do that, and how we do that together. The other thing that is important is, we have a big room here, we have a lot of people here. Apparently, we only have one person that grabbed the card. But if there are times when we-
Pointed at me.
there we go. So if we have, people that are speaking, and maybe, let's just imagine this room gets kind of light, and maybe someone is going on too long, what I might do is I might just tap my wrist. That doesn't mean stop talking. That doesn't mean say we need to wrap up our thoughts. Does that make sense? Because I know this topic is important to everybody in this room. That's why you're here. Support me and support the people of this community. So what I'll do is I'll do my best to treat everybody in this room with respect, dignity, and understanding. It's a big topic. It's an important topic. Fair? Okay, so let's get started. Number one.
So I'm supposed to come up there.
Everybody else,
Okay.
the people that are on. Yeah. If you could have a serious, we're writing these comments down. What we're asking people to do is maybe acknowledge, hey, justice, healthcare, lived experience, family member, providers in the community, maybe just your name. Thank you.
I'm David Gershner. I'm with Dayton Fire Department, but I'm the regional MMRS coordinator, which means we do a lot of work around disaster preparedness and response. And certainly the opioid crisis qualifies as a disaster for our community and our nation. I'd like to start, if I may, by asking a question of Adamus. Where do we stand right now? RI International was providing basically three things: the crisis receiving center, the crisis response teams, and the call center. As I understand it, the calls are all now just going over to the 988 center. Is that correct? And the crisis response teams that they provide do not exist, but public health still is some.
In some police jurisdictions.
And some police jurisdictions. And then what about the crisis receiving center? Is it operating at all? Okay. So my perspective is very simple. We need all three of those. 988 as a national program was not ready for prime time, in my personal opinion, when the feds rolled it out. There are multiple flaws in the 988 system. They do not always know, in fact, they probably often do not know where to refer calls. Calls often go to the wrong place. We have, for decades, had 911 fixed so that 911 calls go to the center that's closest to you. It is not absolutely perfect. There are still mistakes, but it's very rare. My son lives in Oregon right now and has a 937 phone number. He's in Oregon. If he has a mental health crisis and calls 988, they're going to say, well, obviously, where you need to go is immediately go to a place in Ohio. 2,000 miles, you're not going to get there immediately. So, lots of flaws in the 988 system. The crisis receiving center had, I thought, a great deal of promise. It was never totally realized, in my opinion, but I thought it had a lot of promise. And their crisis response teams were doing some good work. Again, big learning curve, big process. Nothing's ever perfect, but I thought they were providing some useful services. So my comment to Animus and the Animus board is we need all three legs of that stool. We need a local call center. We need a local crisis receiving center. And we need additional crisis response teams because there are too many people in crisis and not enough teams, and we just need the help. And by the way, we knew all those things yesterday, so please make that happen, right? Helen can do that. All right, I'll give you till tomorrow. I'm feeling generous today, but there is an urgent need for all this. And then I'll offer one last, I don't know if you have your list or not, but I'll offer one last comment and then I'll shut up, but we have been working with various centers such as the 115 Center, the Crisis Receiving Center, the Coach and others. 115 going back close to 5 years now. And trying to set up a defined process, and we have put together very carefully crafted, excuse me, I am recovering from oral cancer, so pardon the voice. But we have put together very carefully crafted algorithms for when it would be appropriate for a police agency or an EMS agency to take a person to the crisis receiving center, to the 115 center, to any of these places. Not once have we been able to make that come to pass. There have always been delays when 115 has had a number of issues. And again, I'm not saying this to be criticized. I'm just saying there is a lot of frustration out there. And not just in the people who are in crisis, but in the people who are trying to help. So we have in this community what's called a Regional Physicians Advisory Board that helps emergency medical services determine what are appropriate things for us to be doing. We've taken those algorithms to the RPAB repeatedly. They've gone, yeah, this is a great idea, let's do it. And then the next meeting 2 months later, they go, where is it? Well, nothing's happening. We need to start making some things happen. So again, not being critical, just saying it's time to reopen. Let's start reopen. That's all I got. Thank you.
Thanks for feedback, appreciate it. Part of this session in regards to what we're trying to create is feedback, information around putting together an RFP, which stands for a request for proposal, to then put this out to the community to say, hey, look, these are the things that we're looking at. And you're exactly correct. What we're looking for is obviously the call center, crisis call center, or the crisis center, and also the mobile response unit that looks like. So appreciate that. Other feedback, comments?
Yeah. Come on, guys, this is going to be short. You can find the only one of us.
We go.
All right.
Good morning, everyone. I am Michelle Campbell, and I am a concerned citizen and an advocate for this community. I've always have been, but I did raise a very large family, so I took a sabbatical. But the Lord pricked my heart for mental illness because I am a mother of a mentally ill son. And for the last 13 years, When he got out of the military, we have been battling some mentally ill issues with very little resources. So at that time, my heart was hurt. I have hope now, because I see all of you wonderful people out here, and I know I'm not alone. And we all want the same thing for this community, so I do have some ideas that I shared with on Monday and Tuesday, and I'm just gonna briefly go over some of those and piggyback on what this gentleman said. Thank you very much. I appreciate that. I speak to you in your healing process for your cancer. Thank you. So I want to see, hopefully, some type of center, whether it be a crisis care center or one-stop center. Now, recently, my mind has been envisioning a one-stop center for certain mental illness. And what that would do for our community, we can strategize our 988 calls or our crisis care calls. And then, of course, our mobile crisis could be all in one building. We can also have a location within that building, but people are in a crisis. So instead of transporting to an emergency room, we could bring them to our center and we could treat them. We will also need to have an online system where all of their mental information or treatment is in one database. So if they have been getting care at Kettering or Miami Valley, which is also known as Premier, then that doctor who sees this patient would just have to pick something out of his brain and say, okay, blah, 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 blah. That may not work. So what I'm saying is that if he has the previous treatment plan in front of him that he can review, then that makes it possible for them to make a better decision in order to bring that person to stabilization. I also envision, and we talked briefly about housing last night at the board meeting, an opportunity where we can transition them from the treatment center into maybe a 30, 60, 90-day program. So some of you guys probably understand that when they go for crisis care at the ER, they transfer them hopefully to a facility that will help them. However, the longest stay is normally like 10 days, which is great for some mental conditions. But then we have people who suffer with more severe conditions, or we have people who have been refused the medication, and they need longer time for stabilization. So in that particular environment, they can get group counseling, they can get individualized counseling, their family can be involved and know what's going on with their loved ones. Those who don't have a family member to assist them, we can assign them a patient advocate to follow them after they leave the treatment center, make sure that they stay on the medication, to make sure that they get the help that they need, whether it's food, whether it's housing, whether it's clothes, whether it's medical conditions. That's a lot of work. But we did it before. We did it with Montgomery County Family Services Center. And if we can do it for that particular group of people, families and people who received medical assistance back in the day, they now have job opportunity, such as this wonderful center that we're sitting in here right now today. All of this costs money, but I have faith in this community, and I know that we can do it. Beyond a shadow of a doubt, we can do it. We have so many excellent people with a lot of expertise in this community. And I think when we get a great team together, we can bring something magnificent to Dayton, Ohio. It may not be a one-stop center, but it could be a center that meets the needs of our mentally ill community. Thank you.
Thank you. Other feedback?
And I
Yes.
chime in on what she said. First, I want to thank you. That was eloquent. That was a wonderful presentation. I love her ideas. I want to say one other thing, and again, this is not directly relevant to what we're here for today. So I will tell you all, I'm a lifelong Republican. You can throw things at me if you want to, and I was a big fan of Ronald Reagan. But I was a street paramedic when Ron Reagan did what, in my opinion, was the worst mistake of his time as president. That was when he cut funding for mental health services. And I saw in a very short period of time, a dramatic change in what we had available in this community, and then eventually we lost Twin Valley. We have it. I was just reminded that she was talking what a tremendous shortage of behavioral health beds we had in this community, in the state, in this nation. One of the things that we need to have as part of our long-term plan is to have a state mental health facility back in our community. The idea of sending people to Columbus and Cincinnati and Indianapolis and their families don't have any way to visit them is just a horrible disservice. I realize we're focused right now on the problems we had since our international pullback, and that's absolutely where our focus should be. But we also ought to be looking at a long-term greater availability of behavioral health beds.
Thank you. You know, this is obviously a really big subject, most often misunderstood. Someone once said that ignorance is not the absence of information. Ignorance is actually the perception you have. And I think when we talk about mental health in this community, it becomes, we talk about substance abuse disorder, it is a very, very, very big topic. It's very, very complicated. I think part of maybe what my thought is I want to provoke the comfort that provokes. So when we think the three pillars that we're here to talk about, so the call center, right, crisis center, and the response unit. What I'd love to maybe get some feedback on it are two things. I'm a big fan of what could be new, what could be different, what could be better. Fair. I mean, so the first question is raise your hand if you think we lost something. We lost something, that those services are not available today for the citizens of Montgomery County. Fair? So, and I think that's fair. So I think it's, as an organization, what we're asking is what could be new, what could be better, what could be different? Anybody?
Scott, we have somebody on Zoom who would like to make a comment. State Representative Phil Plummer, and he can come off Zoom and make his comments if he'd like.
Perfect. Go, Phil.
Hey, Scott, thanks. You guys, thanks again for having this community meeting. Sorry I can't be there in person. We had a really late night in Columbus. But the RI structure was perfect. That's what the community needs. And hopefully we can get back to that. And once we do, I know we have HIPAA and all this privacy stuff, but we have the majority of these people are just repeat customers. I don't want to call them offenders, but it's the same people consuming up all the resources in the criminal justice system, mental health system. We can target that audience, collect the proper data. So when we drop them off to these receiving centers, we know exactly what kind of treatment they need, what kind of meds they need, where they need to go for help. We did that in the jail with repeat customers. We got them the basic needs they needed, housing, mental health, and that lowered the amount of times they came to our jail, which lowered costs, which gave them a better quality of life. We can do this, you guys. I'm glad Scott's involved because we need more community involvement. And I don't want to be disrespectful to Adamus, but we had the same people controlling all the money, and they really don't listen to other people's ideas. This is a community crisis. We need to really work on this. I mean, I see a lot of you guys, we've been at the table talking about this, and we haven't moved the ball much. So keep working on this. You know, I'm happy to help you guys out with state assets. Somebody mentioned the state hospital. We just got $10 million to buy land. It's supposed to be up by 70 and 75 to start working on the state hospital. So probably 4 or 5 years, we will have another state hospital in this community, which we need desperately. But we need an immediate place to drop people off in crisis instead of the jail. So thank you guys for what you're doing. I appreciate it.
Thanks, Jeff. Any other comments on Zoom? Tina, have you heard it from anybody else?
Yeah, and ask them to let me know if they.
Okay. Oh, I thought your hand went up.
I mean, I'm willing to say something I really like to not, I would say they're there.
This is the second meeting that I've been to and I'm hearing the same thing over and over, which is true. We need the call center, we need crisis receipts, we need mobile units. At the same time, this is about giving Adam's suggestions on how we do that, not what we need, we already know what we need. So understanding that one of the things that I would like to see is, if possible, we have an appropriate local vendor that can take care of this, that is already working in our community, already knows the relationships and the resources that we have. That's what I would prefer. You know, Montgomery County is doing work that I really don't think any other county in the entire nation is doing, with our collaboration and the treatment and recovery environment and almost family that we've built up over the last decade. So, you know, I'd like to see a local provider if possible. I would like to see more stringent contracting. 2 weeks to say adios. No, we need to be able to, if somebody needs to pull out again, we need to have enough time to be able to troubleshoot and get somebody in, even in a temporary capacity until we can solve that problem. So that's kind of where I am, and those are my suggestions. You have, you know, a lot of people in this community that are subject matter experts and are passionate about this and want and need this to work. So you have to listen. You have to not only listen, but you've got to consider and really look at the data and weigh the information that we have to make sure that this time we don't get burned with 2 weeks notice.
What would be, so if I had asked you, like, what would be just a proper notice time? 6 months. Does anyone disagree with that? Or agree with that? Okay. Other comments?
My name is Teresa Hancock, and I'm a manager for the social workers of the emergency room at Montgomery County Hospital. So I think my comment is that also we need to have some better communication. I think that with RI, there was always this, I didn't know, like the left hand didn't know what the right hand was doing. And I think that the next time when we have a plan in place, that there needs to be better communication and better, like, who's doing what and everything else. So that's all I have to say.
And I think that speaks to having a local provider if there's an appropriate one, because we're on top. So having somebody come from outside, not understand this environment that we've built is gonna result in that.
Plus, the piggyback on what everyone, just to piggyback on what everybody else is saying, I mean, local providers know who are frequent people that we all have contact with. And to bring somebody in new that doesn't know anything and trying to catch them up, it's just kind of ridiculous to me, but that's just my opinion.
If I had to ask for something that RI did really well, what would that be?
Near the end, I think they were trying to
made contact, at least I'm just talking for the, like, I won't talk about Henry, but it probably, I don't know, I say the same thing, but I think at first it was, we don't need the hospital, like, we don't need to come and talk to you, we have our own crisis receiving center, so we don't need you. And then all of a sudden, it turned into, oh, we're having to bring them to the hospital, because there are patients that need to come to the hospital and they need that immediate whatever, I mean, there's no stuff and whatever. And so then it was like, after the 8 ball, like, oh, now we wanna come and talk to you.
Thank you. Now I'm getting participation. Apparently it's moving up here.
My name is Jackie. I currently work for 115 and I have worked as a mobile crisis first responder. I would say, any changes, I facilitate groups all the time, I keep the mic in my hand and it makes me very nervous, so bear with me. Communication is very important, I think, and in order to have community buy-in, all the community partners need to be a part of the conversation and be a part of the implementation. And so having law enforcement be involved in the conversation when whatever organization comes in to take on these mobile crisis, CRC, whatever call center, we need you to partner with us, you know, in those things. We need the hospitals. We did try to have conversations when we would go in, we would do a warm handoff, but it wasn't always, I think there was just a breakdown in communication there. And so in order for it to work in the community needs to buy in, and then our community partners in building those relationships and maintaining those relationships. So ideally, in my mind, when we get somebody to take on these services, continuing to have those conversations, not once it starts then the communication stops, but keep having these conversations, keep having the meetings, what's going good? What would we like to see changed here? Because again, if law enforcement no longer is involving the crisis services because things aren't working out, you know, the way that they would like, or the hospitals aren't really interested in our services either, you know, then it's not really going to work. And so continuing to have the conversations after the implementation has started, I think is going to be extremely helpful. All three legs of that was highly important, as everybody kind of noted in the past. Having a standard, I think, is something else. So we need to know who's coming in and what are their qualifications and what is their training, and they need to do trainings to be able to facilitate these services. And crisis is extremely difficult because you never know what you're getting into. When you walk through that door, you may hear a call center get something, you walk in through the door, something's completely different after you get there, you know. So having these continued supervisions, training, and having the proper education.
I think just to piggyback on that community piece, one of the key things for me is that community is not in this room. Can y'all hear me? Thank you. So community is not in the room. So a lot of times this process is a 2 and a 4, and it needs to be a with. We're professionals in the room, which is part of an integrated process, which we definitely need. It needs to be holistic. But we're doing this for the community, and are there actually members of the community in this room that aren't professional workers? So those are the people that I would like to hear from, because as a community social worker, I can't do my best work and then I'm meeting the needs of people if I'm not asking the people what they.
Good morning. My name is Anthony Whitmore, and I am a person in the community, but I'm not speaking to you this morning as a community. Speaking to you as an individual who had an opportunity to continue to see people in our community that often we look away from. I saw a young man who had been put out of one of the hospitals, and I thank God for you social workers, those nurses who are in the hospital, as well as those who are professional. But I had real issues when I took this young man over to the hospital. And then within less than, I guess, X number of hours, he was released back onto the street. I asked the people there, then where should we take this young man? It was very clear, 30, let's see, about, I guess, about 37 years of age. Had been in a lot of trauma. And it was very clear that he was still experiencing that trauma. So much so that I felt. So then I thought, well, let me reach out to some other, I'm not gonna mention names. I reached out to other groups in our community. Only to find a disjointed group of professional people who had no real, what I felt, connection, if this were my son, to the general welfare of this individual. Now I decided, well, so we're gonna be taking one over to the home shelter. Well, have you been over to the homeless shelter? They said, well, that's the best we can do. Why am I saying that part to you? I appreciate young lady about the community will. Yes, we've got to care. We've got to have qualified caring professionals for those individuals. And once we get them in, because my journey went from January till just say several weeks ago, trying to get this individual into a program that he had already been in, as I finally got some information. Yet there were still disconnects in the system. Each place that I would take him would ask for the same intake information. And I'm just sitting here listening, trying not to be judgmental, because I wanted to see what was the journey like. And I can assure you, ladies and gentlemen, I was overwhelmed and disgusted. So whatever it's going to look like, it's got to look like a place where these individuals feel comfortable and they know that they can be welcome. That young man that I spent day after day going through different places, and I will say, in each of those places, there were people who cared. They really were. But even those people's hands were tied. Now, they didn't know, some of them knew who they were talking to, but most of them didn't. So then I went and got my brother's new rag, put on my ears, put on my glasses, so I didn't look like who they used to see. Because I wanted to hear the truth. I also was challenged with this individual looking for help getting his meds back, getting back to the psychiatrist. So I learned a lot just walking day to day with this young man. Where is he today? He's on the streets. I had to go to places that I used to go to. Trying to find him. His children. And when I found him, he was back with the people that were giving him drugs of the street, not his medication. So Scott, whatever this is going to be, let it be from people who really care about the people in this community. These are our brothers, our neighbors, our folks that we say we should care about. And when that call is made and that information, whoever it was, it said, when that comes up, we talked about having a connected network. HIPAA or no HIPAA. We need to have a way to know when you drop an Anthony off, that you get that information right away. Don't ask me the same old ridiculous questions that you asked me earlier last week. That communication system should be technology, and I'm challenged with it. But it ought to make sense. So get rid of all the barriers and stop talking about what we ought to do and just do it.
Thank you. Yes.
Anthony, to build off what you said, my name's Andrea White, like Phil, I'm a state representative, and I want to tell you, I know there's a lot of people of good faith and passion and efforts who have been in the front lines for many, many years, way longer than me. I have skirted this issue. I remember being in the Dan Foley, Jim Panko's substance abuse and drug, task force back in 2009 to 20, whatever. Then it morphed into, the opiate epidemic hits, the community overdose action team, and we have the drug free coalition, the prevention coalition, all these different efforts. And everyone is trying. And everyone knows, as the person said earlier, what we need. We back still, like 15 years ago, we need a place where people can go in crisis. We need people prepared to respond. We don't need the jails, the hospitals, and now it's our group homes in the streets. That's where people are going. And so we've got to figure out a better way. And as Anthony was saying, I believe we have designed our systems in a way that works for the system and not the person. And when we redesign with the person center at the center and just blow it up and start over. Begin with the person in the center in mind, and then we work outward from there. How do we design our registration processes, our access to services, our, dare we say it a lot. We have so many silos in this community and victims. And frankly, everyone is relying on dollars and competing for dollars, okay? Which leads people to feel insecure and trying to protect and maintain. We've got to start over and look at how did we build our system? Where's the problems? And as the person said earlier, can people from outside of it in looking in, people like Scott, business community, people who've been involved over the years, but we need to thoroughly engage. We need parents engaged. We need patients and people who struggle with these issues engaged. We all have our personal experiences where someone has been admitted to the hospital, whether it's for, drugs and alcohol crisis or a mental health crisis, only for the hospital to be, in essence, they've got to release them because that person's an adult and they're saying, I'm fine. And they answer the questions right, but the family is all like, no, they're not. And so, one of the things we're working on is, this is just, prevention is so key. And where do we cut the money? Prevention always gets first. And if we would invest in prevention, we all know the stats, $1 invest 10, 13 dividends. And so we keep having a greater number of people struggling, and we don't need to do that. If we would just invest more in prevention from our time the baby's born, time the mom's pregnant on through, what can you do to be an effective parent? We have initiatives in the state. We need to fund things like triple P parenting that we're funding, these centering pregnancy, all these different things we're funding. We need to hear from our community and say, begin with the end in mind. The end is a healthy, happy, functional, successful human being. Let's work backwards and find out why that's not working and why we're not working right and what is in our own hearts. What is it that we're holding on to because we're afraid to lose something, And so I just sort of, like I said, I have really random thoughts, and I apologize if others have talked about this. I haven't really. The workforce is a tremendous problem, right? The pipeline of workers, rooms are closed, things are closed because we don't have the workers. We need to have, this is great, these meetings, And maybe there's been others that I just haven't, I know different sectors work, but we need to get a cross section of people in a room talking about these problems. People in the high schools, in the middle schools, the ESC does a great job pulling people together. Let's leverage the ESC, the Greater Maine Hospital Association, the addiction and mental health networks, parents, communities, community activists. Let's get us all in the room in a smaller group where you say, send a representative, let's work on these issues. I think about, we've got to figure out at the state level, I know our reporters listening, we have a $10,000 scholarship for people who go into mental health. We need to get more programs and initiatives and communicate about those to build the workforce. We need to help, our schools as well as our high schools and career tech programs. In terms of the continuum of care, this is a real problem. You have the hospitals say it clearly, the group home issue where you've got people in the hospital who shouldn't still be there. Children's hospital, adult hospital, there's nowhere for them to go. They're not ready for the community. They're not ready to go home, but we have no place. So instead they end up in a proper place. Dare I say, we're warehousing sometimes because we don't have the network and the safety net. And if we would just invest a little bit more in prevention up front, perhaps we would stem the tide of the volume. But I would encourage all of you to keep talking to anybody who has any sort of access to resources or ideas. We need a continuum of care in the state that we don't have. We need the hospital setting, yes. We need the new state hospital. There's such a long waiting list that'll be filled immediately.
Yes.
But we also then need a place for people to go, so they don't end up in the juvenile justice system, and the adult justice system, and all these other places. So this, interim places, then the therapeutic group homes, then this whatever, you all get it, you're in the, most of you are in the system and you understand. Just a couple of quick other thoughts. So we have a medical power of attorney where you can sign off. We're so great at promoting that. There is a declaration of mental health treatment in the Ohio Revised Code that is not widely used as it should be. We need to get thinking about when kids go to college, they have mental health breakdowns more frequently. Schizophrenia and some of these issues display themselves. So one of the things we're working on, with the 988 and the student ID in college, making that aware is maybe we need to start talking about that with orientation. Students, you have this, you know about it. Maybe we need to start talking about that with families when someone is in a better mind space. So they can sign a paper, whether it's, maybe they don't want their parent to be the one, but maybe there's another trusted adult they trust. We've got to get more access because you all know if someone's in a state. Yeah, and I think Judge Brandon was here the other day, he's working on things there where when you're in a state and you're not able to say yes, I want that medicine, and then you don't get it in the right time frame, your mind deteriorates and you can't go back to where you were. So, how do we get the paperwork out of the way and help people feel safe that they can trust to give that permission while they're in a better mind space? So I think we should try to promote that and tweak that. If it's not right, you guys in the field know this way better than me. The mobile crisis teams. I've talked to many law enforcement people. We need to go back to a partnership thing where law enforcement is involved and these are embedded more. We need to figure out a way to fund this where they're in the departments. If we could prevent the situation that escalates to the jail or the hospital or whatever, and have, where can we make the investments where they're going to basically, reduce the demand for these in-demand services that we don't have enough of anyway, So again, getting representatives from, maybe you've done this already, again, I apologize if you have. Getting all the law enforcement agencies and invite them in with the, and let's talk about it, and let's figure out funding ideas, and let's reach out to our business community and our philanthropic community. How can we involve more partners? I'm almost done, sorry. I guess I just really think that it's easy to get in our silos. I think I covered everything, but the main thing I want to talk about in the end is the silence. Everybody, all of us need to look in our hearts and say, what am I holding on to that I should be engaging others with because I'm afraid I will lose resources? And how can we partner together and not do that duplication and not have these silos that cause us to not communicate and frustrate the system? And you need a master's degree to navigate where you need to go for help. So last meeting, somebody said, I don't know where to get resources, I don't know where to get help. We gotta do a better job, and I know everyone is doing this, do a better job. And, you know, the legislature, we're here to partner with you, we just want to keep talking, and I appreciate this opportunity.
I apologize for the emotion, but not I also, the last part, I wanted to remind us of one thing is always, that always happens. And this is not offensive to all of you that are professional. Thank you for what you do. But we've got to get you connected out of those silos and you're talking to each other. But look around you. What's missing are people like the young man I just told you about. They can articulate their need, their concern. So why are they at the table? They're the one experiencing, they're the ones who are going through it. That's it.
Can I hear you this?
Good morning, my name is Jordan Hobbs. And I am the mother of a son with mental illness. My son went to the public schools, went to Middledale Elementary, fine. Went to Stuyvesant School for the Arts, fine. Was part of the jazz band, played piano, fine. Decided that he was going to go to the Air Force. Now, I told him, I said, I wish you would have told me you wanted to go to the Air Force because I was a teacher and I was a field marshal, and I know I became a little familiar with that he could have done some of the training while he was there in Middleton. But he was good. He played basketball, all that fine. And then my son came home from basic training with the Air Force. Had to be escorted, diagnosed with mental illness. I didn't even recognize him when he was at the airport. His face was swollen, they had put him. At the time I was here and I could not go see him because unfortunately I was going through my own through because of some abuses I was getting. I had been falsely accused and I didn't let me travel to go see about my child. I have a second son who was, by the grace of God, seeing his older brother and his mother going through, but he was being kept. I bring all that background to say, my son can communicate, good vocabulary, but why he's not here, and for him and for many others, they feel used. They're just a social security number to be used at a cost them. When my son came back, I was given papers and told to take him to a particular place. We went there and then started the thing with the this law that your parents can't know about their children. They say it's privacy. It's not privacy. I'm his mother. I thought that maybe in some families is abuse. Can the professionals here not observe a relationship between a mother and a child, family member, and the other, and say that this is a healthy relationship? Let's put aside this. What is the law? I can't even remember it. I should remember it. The HIPAA. This law should be purposeful. They're not just there just to be there. If HIPAA was instituted to address abuses, when those abuses are not evident, for goodness sake, can some professional document it and say, so we will step aside this him? They picked up my son and someone decided to put him, they took him, there was a time he spent time away. I called to check up on him and they wanna ask me about a code. To begin with, they don't even wanna acknowledge that he's at the place. I know he's there. I know he's there, and I called him, I said, this is, I have this health power of health veteran, and I expressed that on the phone, but they wanna ask me, did he give you a code? I haven't spoken to him, he doesn't even know that you have a code system going on. So for them, but I'm the person you talk to. And then when I called, they said, oh, he's isolated, he's not engaged. Well, you can come for visiting hours. So the professionals. You don't know you. We still have biowitness. We still have our biowitness. He's 31 years old now. The other day he went to the Y and he mistakenly left his bag there overnight. And they have their policy, so they took it out and whatnot. He didn't want to talk, but he called and said, Mom, I didn't know my stuff. But we went away. He talked to me. But this is the sort of stuff I'm talking about. He talked to me. But let me get off my, but they're not here because they've been shuffled around. After one time, he was at Summit for months and months. Summit discharged him and they sent him to another hospital. That hospital put him out. And my son was on the street for days. God bless, it was I live in Harrison Township, an officer, one of this, driving around with my son, and one of the officers at Harrison Township, they helped me with a group of other people over somewhere on Fifth Street. They located him under the bridge on 2nd Street, and he had a home. But he had been, I don't know if people get familiar with the story of the prodigal son, for some reason, he was embarrassed. He made assumptions about his mother, that his mother would not, but if people familiar with that story, that son would be hurting. And his picture look evil, his dad, that he didn't believe that, that's what his dad saw him. He went out and that's what eventually, but my son was embarrassed because he thought that I had high expectations for him than what he had turned out to be, so he was hiding, he was ashamed. But I love him, that's fine, but the system is keeping us apart. The system is keeping us apart. While we're talking about all of this, I wish we would start a process as to where we want some of this stuff to be, because the last thing we need is for lawyers to eat up funds about location. And this, that NAMI thing, not in my backyard, and some lawyers eat up all the money going through hearings about this place not being approved and that place not being approved. So let's start finding, and let it not, I think they already have a place out of town. My son will go to, he doesn't think he's welcome in Centerville. They keep trying to tell him to go to the sunshine or something. Catch the bus to go out there. Why don't we have a place close by where they could go and hang out instead of going to the public library where they don't necessarily fit in? Be glad that that works sometimes, but it's not that good.
Thank you. Well, we have about 20 more minutes. You know, I heard a quote one time, and it said, every community deserves the circus it creates. When you think about it, I mean, would you agree we have a lot of people deeply care about this subject? Deeply care about this. And then we have a lot of people that have been involved in this system for a long time. We have also the type of I talked to a lot of parents, and it's been 16 years in recovery. I watched, unfortunately, 16 of my friends pass away over 16 years. And I've watched them kind of walk through this process, and they get engaged. And mom and dad feel confused, they're scared. We're afraid. And I think one thing I love about this community, I believe this community, we are nimble, we are quick, we are fast, we have gigantic hearts. And can we solve everything? No, we can't. It's a big, big problem. Can we do better? Absolutely, we can do that. And I agree with what you said too. You know, there's a lot of employers that deeply care about their employees. Deeply care about their employees and their families inside of their environment. And they're willing to lead into this in different ways. They're really willing. And so what is that, you know, what's that? How do we bring that to life?
Another thing, just to kind of stay solution focused, I know an issue with the system we had before was funding. And so I think that, yes, Medicaid billable services, a lot of organizations get funding for Medicaid, but if you can consider if you are in crisis or you've known somebody in crisis or you've worked in the field for a while and you know the barriers that our individuals face, a lot of them don't have ID cards, a lot of them don't have insurance cards, a lot of them might not even have insurance. And so really what I would like to see is us consider multiple funding sources, Medicaid for those who are stable enough to be able to provide their insurance information. Or insurance funding, so we can build that, but then also having some type of charity care, grant funding, something like that, a philanthropist be able to help support us. So solution focus for the funding, and then I would also like to share a little bit of personal history. I got into this field because I myself have been one of these individuals that have needed services in the community. I am a person in long-term recovery, and so going through navigating these various systems, I wanted to be able to give back and to provide support to individuals that are in similar situations to what I found myself in. So there are people at the table here today that have those experiences. And how did I get here today? I was personally invited to the table. And so how do we get more community partners or community individuals in the community? How do we get them here to these tables? We personally invite them to these tables, just having it open to people, to have to look on Adamus website. I don't know a lot of my friends that are gonna go on the website and just look to see what's happening. And so I am blessed to have somebody in my life that invites me to the table to have these conversations so that my voice is heard. And so having individuals brought to the table that have the experiences that are utilizing these services is very important. I fully agree with that. And so we need to just consider, let's bring it to the table.
Well said, well said.
Now, I repeat what I was saying before. Verbiage, our language that we use, I forgot that point, I was going somewhere with my son's situation with the Air Force. He said, I did not raise my children were not being yelled at. I was not a parent who yelled at and beat children, I didn't do that. I was raised with a lot of talking to, and that's how my son, but when he went to the airport, there was, in their training, it was common to be, have somebody in your ear yelling. And my son's response, some of the kids who were street smart, said they would yell back. But that's not what he came from. He shut down. And this person got even louder. And my son said, Mom, I was that? Yeah, I hear the voice. I hear the voice. And then the next thing he said was, he said, I hear voices. And that's how this situation started. And he got put in isolation and started being treated with heavy drugs, messing up his brain. And this is continuing. When you say one thing, but somebody else hears something else. And they run with what they hear or what they think they hear. And the next thing, you're being treated for something, and it's part of another thing why some of them don't feel comfortable talking or coming. Because they say, remember when I was teaching school, kids say, I feel you, and I said, what you mean? But it had to sometimes I language and people take things. And the next thing you start being treated or mistreated.
Other feedback.
Not gonna come from, but I understand what you speak. When I hear everybody's input, I say, yeah, wait there. A lot of times, we don't understand mental illness, so let's educate ourselves on mental illness. First of all, when we talk about mental illness in this room, we're basically talking about adults, so we have kids that we gotta think about. It's been proven that basically males, especially males, 1 in 4, by the time they're 21 years old, will have some type of form of schizophrenia. That's without going to the military. A lot of our young men go to the military and that exacerbate that quickly. And the military doesn't understand that, unfortunately. And the kids, they get wrapped up in that, like she said, hollering and screaming, degrading, etc. So something that they're not used for. I know my son wasn't used to that. He came from a loving one-parent home, and I was a phenomenal mother and a provider for my children. So we're talking about the adults, but we got kids, teenagers that's gonna be graduating from high school, that's gonna be going off to college. They're gonna have a dramatic experience or something. And if they come from our community, we need to make sure that they know that they can come here for help. I'm gonna push this one-stop center one more time. One more time. Because what I hear is that we need, it doesn't mean that we have to not have our East flag or our haven or any of that. But what it says to our families, our community is that we got a place. You're not alone. Come here. Let us deal with this and get you the proper help that you need. Maybe you gotta go to South Bend, as the lady was talking about. Maybe you gotta go to Kettering Behavioral Health. They just changed their name, so I'm used to the old name. Maybe you have to do that after we bring you to the center. And that have you evaluated, that you connected to the resources that you need, give you some love and understanding, and most of all, compassion. You're not alone, sister. You're not alone. I came here messed up young lady. I too suffer with mental illness. I was diagnosed with PTSD from a traumatic childhood that I had, but I got help. And I'm standing here today in my right mind, knowing my worth and what I bring to the table. I could have been like somebody else. I could have been out there up under the bridge sleeping. I could have been shooting dope in my arm. I could have been religious. I could have been all of that. But I wouldn't got help. I talked to psychologists. I talked to psychologists. I had people into me. They didn't even know what I was doing through. And look at me today. A better person, a better mother, a better grandmother,
a better great grandmother, and it didn't take me getting locked up to do that either. The resources are out there. But we gotta bring it to the people. We can't expect the people to come get it. We gotta bring it to them. And we have to start today. So when we leave here today, and the Adams Board and Doug Brandon, who I met with the other day, that's doing phenomenal work also in other areas, when we all collaborate together, we can make this thing happen. And I believe that we can do a center and a mobile crisis that's gonna work for our community. And I just feel very strongly about that, very strongly about that.
Thank you. Excellent. Thank you.
Okay, a few more minutes.
I would be open to, with the supervision of the professional volunteer time, sign up to volunteer time. You know, let's have a schedule, a rotation schedule where those of us who would benefit from it or have benefit or just because. Sign up once a month, once a week, 2 hours, come spend time to show love and compassion. Because after dealing for the grace of God.
Been up the experience I've had the last several months being with these individuals, walking with them. The other part that really got me, God bless you, openness, but what really got me was when, and I know this is their job, but I was told in order for this young man to get help, you need to tell me what bridge that's he resigned under since he has no place to go. And then I was further insulted when they said to him, we can give you a blanket. Now, this is in the winter. And I said to this, I'll say to these two individuals, and when that blanket is wet and cold, where does he and the others who live under these bridges, do they get that water? Do they just have pneumonia and die?
So here we go. My name is Christina. I'm a social worker in the community. I work downtown right now. In my previous role, I was a co-responder with law enforcement, so I was embedded into police departments and did crisis response alongside them. Being very solution focused, I think we have some pretty great examples of models in our community now that have been working. My previous position as a co-responder, that works. The departments loved that model. They loved having a social worker there who could, provide the resources, provide the knowledge, provide the follow-up, to reduce those calls and get people connected to the needed services in the community. Oftentimes that officers don't have that time to do those things. We have our MRU team, our mediation response, like that's a great example of a mobile response unit. They're designated for mediation, but again, they're taking those calls from our system that they can go to, they can respond, and they go out on teams, they're on the streets doing the work. So having that crisis response unit modeled after something similar to the MRU, maybe, again, they're already out there, they're going in teams, they're taking calls straight from their call center, from the dispatch calls that they have. And so we have some really great models in our community. So building off of those that we already see instead of reinventing the wheel. And then the last piece is consistency. I've been a case manager as well and a therapist, and one of the things, especially in my community mental health, that we hear a lot from clients. I don't wanna go anymore because I just have a new case manager and another new case manager or another new therapist. I'm tired of explaining my story over and over and over again, so I'm just not gonna do it. And so having, when we, get these, what are they called, the RFPs, proposals, like making sure that whoever we're picking is going to be a consistent place in our community that is going to have some longevity where people know that they're going to call and it's going to be consistent. That it's not gonna be 6 months and I'm gonna change again, or, a year or 2 years and then we're gonna change again. And having that consistency, because for our individuals who really need these services, that lack of consistency makes it even harder for them to access treatment. Then just like, the gentleman down here said, then they're going to this place, and then that place, and then this place, and it's just so hard, to make sure that they're getting the needed treatment, the necessary treatment that's beneficial for them. Christina.
I was totally here. I work in the community, I work in Dayton Public Schools, I also work as a therapist at a facility. I used to work in Dayton forever. And, when we look at our consumers and clients, people we know, we look at them as, productivity. And I hear this young lady right here, and that gets burned out real quick. And therapists run from place to place. You got to have a master's to treat people. I mean, you got people that's down there that will volunteer, like the lady said. We have this meeting inside when the meeting should be outside. And we're asking the people to come, but we, like you said, we have to go with them. But when we look at funding and things like that, all I see is the person is making my day. Now, I need them to come to me so I can get my check. And that takes the care out of it. When we have loving, compassion, and caring concern, as if that were me sitting in the seat, because it was me too, sitting in the seat before. And that's why I decided to be, I'm here as a community person today. But when we look at people as productivity, that's an issue for me. I just want to come to work and help somebody. Every job interview that I go to, I say, I just want to help somebody. I don't have to get paid to help somebody. I just want to help somebody because I'm commissioned. I'm a missionary. I'm commissioned to help somebody. And if we're looking for funding, and we're looking for those things, and I know we need money, but it don't take money to get outside the ball and show somebody that you love them. We have to show people that we love them. We got to start loving ourselves. And she said the case managers and the therapists, they change because they get burned out. And when you talked about the assessment, when I do assessment, I'm doing, like you said, understand the same thing. Why am I doing that? I'm wasting time with people when we can get to the heart of the matter instead of wasting their time. And when we, because the information don't change, we can do the assessment every 6 months, every year. Don't, if there's something to do, then that's what we should be asking for. We asking the same information. But they just need to be loved. I want to do the same love that I have is what I can show somebody. I don't want to have a master's degree to do that. I think we were asking, you gotta go through all this education, you gotta pay all the money back. Just to help somebody. I just want to help somebody. In the school system where I work in, I just want to help somebody. And I know that we all do, but we can't look at people as productivity. I mean, We cannot look at people, and I'm like, why am I'm making my money because I gotta have this many clients, this many, and people, your caseload like a out the roof. Can't keep up, and then you still doing all this paperwork, saying the same stuff. So how can we just get back to the simplicities of helping? Just want to help somebody. Like this young man said, we out here in the street, we can't have a meeting, like, we're comfortable. I feel the cool air on me, but we gotta put on our tennis shoes and not be afraid to go outside. That's where they're not gonna come in. It's okay if we can't, this whole group went under that bridge where this man said, and just show the people that we love them, not to ask them we know what they need. Just show them that we can give them what they need. And she don't care, I can go, but let's get back to helping and get off of the productivity. Volunteering, my God, I help somebody every day. I'm glad I'm off in the summertime, but I help somebody even if I'm at work. Whatever job I make, if I'm not at work, I'm still helping somebody. Thank you.
Okay.
But I'm gonna see if we can pull the chat up. We do have a comment in the chat. Send it out.
Laptop, someone else.
Oh, is it? Okay. Can I read it? Would you like?
Oh, yeah.
Okay.
Oh.
We have a comment in the chat. I'll read it to please. I've been working in the community for the past 40 years, working in Montgomery County. We need to do better for our clients. We can't continue to end treatment the way we do. Every time this happens, it creates more barriers and more trauma for our clients. It takes a good 20 to 25 years to establish a good facility in the community. We need to have a good partnership with the providers and not in relationships. It hurts our clients, the ones who need it the most. It's tragic what continues to happen in our community, and it shouldn't be allowed to continue. Thank you for that comment, guys.
Well, it's like we said at the very beginning, one is thank you for coming here, thank you for participating, sharing feedback. Said, our goal is how do we serve the lonely, tired, broken, and afraid? How do we do that in beautiful ways for people? Where I was at Montgomery County, we had a mom. We brought mental health to life inside of our organization, and the mom came out and told me this story that her daughter was dealing with mental health issues. She actually got a text from her daughter in her bedroom. Mom, I'm thinking about hurting myself. Can you come and talk to me? Can you imagine that as a mom? I have 3 kids and keep attention. She goes, and the beautiful people at Baby Children, they're doing great. Served her family. But unfortunately, the next available appointment after that discharge was 9 weeks. So, like, what's a mom supposed to do? Now, there's other stats, there's other resources. But this mom didn't know what those were. And I think as a community, we can do a better job of giving people waypoints, other options. It looks like a spider web. I said this yesterday, this whole thing. There'd be substance abuse disorder or mental health. It's like a spider. It could look like, in my opinion, like a PVC pipe. How do we put that together? And even you said that as busting down some silos, because the people in this room, you do this work every day. You work in the heat every single day. What your work that you do, and I'm sorry, you watch brokenness every day. You look at some social work. I mean, that's what you do every day. You know what you do? You create shade for people like me. Because I entered that deal with me. The eggs and the shade is all I'm getting. So Thank you for participating today. Grateful. We've got, thanks for scribing all of those notes. There are tons of notes, but what I heard, even as we close here, is, I would say Montgomery County, the citizens of Montgomery County were the customer, fair? So the entity, the organization that is sent to this, in other words, what promises are they gonna make to you? And if they break those, what are the consequences for breaking those promises? Simple as that. It's not any more complicated. And how we bring it into life. So thanks for being here. I saw a long time ago, so I'm coming here right on time. Have a beautiful day.
I get you sent me the services. Let me answer.